Microsurgical vasectomy reversal. What you need to know prior to microsurgery and reconstruction for infertility following a vasectomy. A vasectomy is a common sterilization procedure where a piece of the vas deferens tube, or the tube that delivers sperm out into the ejaculate, is removed. After 2 to 3 months following a vasectomy, a semen analysis will be performed to confirm sterility. A man continues to make sperm following a vasectomy, but the sperm no longer mixes into the ejaculate at the time of orgasm. The only option to conceive naturally following a vasectomy is to perform a microsurgical vasectomy reversal. The goal is for sperm to return to the ejaculate so that couples can go on to achieve a pregnancy naturally. The alternative to a vasectomy reversal is to extract sperm from the epididymis or testicle and then have in vitro fertilization and intracytoplasmic sperm injection. This is referred to as IVF ICSI or a test tube baby. The amount of sperm retrieved from a surgical retrieval is not enough for intrauterine insemination. Intrauterine insemination, or IUI, can only be performed with ejaculated sperm. Adoption and donor sperm insemination are also options to have a baby following a vasectomy. The reasons to have a vasectomy reversal are to restore a man's fertility following a vasectomy and to treat post-vasectomy pain syndrome. The most important thing when considering having a vasectomy reversal is to carefully choose your surgeon. The surgeon should be a fellowship-trained microsurgeon who regularly performs vasectomy reversals and can provide you with their personal outcome data. Microsurgical vasectomy reversal success at the Vasectomy Reversal Center of America is greater than 90% of normal sperm numbers by 6 to 8 months. The biggest risk with this procedure is failure of the vasectomy reversal to restore fertility, which is 8 to 10%. The risk of bleeding, infection, and chronic pain are all less than 1%. There are many advantages when considering options for fertility post-vasectomy. The major advantages of vasectomy reversal when compared to IVF ICSI is that you may have restoration of fertility to allow for normal sperm to return to the ejaculate. This is the only way for a woman to conceive naturally following a vasectomy. It allows you unlimited pregnancy attempts, no hormonal therapy is needed, and there's no increased risk of multiple births. Because the procedure is performed under general anesthesia, you will need to fast starting at midnight the night before. You will need a pre-op exam, blood work, and an EKG with your primary care physician. You will need to have a ride home from the procedure and a responsible adult to be with you the first night after surgery. Certain medicines like blood thinners may need to be stopped for 1 to 2 weeks before the procedure. You may be given a prescription for an anti-nausea medication to take the night before or morning of the procedure. Vasectomy reversal is usually performed in the ambulatory surgery center or the urologist's office. These are usually located either adjacent to the office or in close proximity and are specifically designed areas for outpatient surgery. Some patients may need their procedure performed in a hospital, usually when there are underlying medical conditions that require this. On the day of surgery, you'll be brought into the operating room and placed comfortably in the supine position on your back. General anesthesia will be administered by an experienced board-certified anesthesiologist. The operating microscope will be brought in and used to assist during the procedure. The area where the vasectomy was done will be identified. The surgery is performed through the scrotum. After the scrotum is incised, a simple cut is made to the vas deferens above and below the site of the vasectomy. The fluid is examined from the lower vasal segment. Favorable findings are when you see clear, free-flowing fluid with sperm present. The fluid is evaluated to see if another blockage has occurred over time in the epididymal gland. Your surgeon will determine at that time if a vasovasostomy or an epididymovasostomy procedure will be performed. The microsurgical vasectomy reversal is performed to reconnect the ends of the cut vas deferens, the tube that was cut at the time of the vasectomy. One of 2 procedures can be performed at this time, either a vasovasostomy or an epididymovasostomy. On average, surgery takes about 3 hours to complete. At the time of surgery, the microsurgeon will examine the fluid from the lower vasal segment to determine which reconstruction will be performed. The surgeon will also confirm patency of the upper vasal segment by irrigating saline north. Surgical outcome and success are based off the quality of this fluid and which reconstruction needs to be done. There are two different types of vasectomy reversal procedures that can be performed that will be determined at the time of surgery. A vasovasostomy is the procedure to reconnect the cut ends of the vas deferens. An epididymovasostomy is a more technically difficult procedure that sometimes needs to be performed when there is also a blockage found in the epididymal gland. Following the procedure, you can expect to be in the recovery room for 30 to 60 minutes. You'll need to take 1 week off from work to be resting at home. After that 1 week, you can resume normal daily activity, but should avoid strenuous activity for at least 4 weeks. It's important following the procedure to apply ice to the scrotum 20 minutes on and 20 minutes off while awake for the first 48 to 72 hours following surgery. It's also very important to wear the scrotal support as your surgeon recommends following the surgery. Please avoid heavy lifting and straining for at least a month. You may shower the day after your procedure. Just pat the scrotum dry. Do not rub or wash the area. Avoid a bath or swimming for at least 2 weeks or until sutures have completely dissolved. We recommend no sexual activity for 2 weeks, then regular frequent ejaculation to help keep the reversal sites open and sperm traveling through the vas deferens into the ejaculate. One of the most important things is at the 6 to 8 week mark, the microsurgeon will have you perform a semen analysis to determine if sperm have started to pass through the reconstruction. If no sperm are seen, then an anti-inflammatory medication and an antibiotic may be prescribed at this time. A postoperative visit to examine the incisions and look at healing will also occur around 6 to 8 weeks following the reversal. When you're at discharge, your doctor will prescribe an antibiotic for a few days, oral pain medication as needed, and a stool softener. Please call your doctor if you experience a fever greater than 101.5, chills, severe pain, difficulty urinating, nausea or vomiting, or any scrotal swelling, bleeding, or worsening pain. The surgical coordinator will discuss with you if your procedure is covered by your insurance. Often this procedure may be self-pay if it's not covered by insurance. We will communicate with the insurance company to determine your coverage and inform you of any co-payments or deductibles that might be owed. We'll provide you with an estimate of any charges that you may incur, and if the procedure is not covered, self-pay fees will be reviewed with you. All charges are due prior to the procedure and payment plans are available. A surgical scheduler will contact you to arrange your surgery date. You may need medical clearance with your primary care physician or internist, which would include a history and physical exam, as well as possibly blood work, EKG, and chest x-ray. You will receive a letter with all of this information, as well as where and when to report for surgery. Because you will be having general anesthesia, you may not eat or drink after midnight the night before your surgery. Prior to your vasectomy reversal, our operating room nurse will call you to discuss the following: which medications you can take the morning prior to the surgery, what time to arrive for the procedure, and that you need to have a responsible adult with you the day of the procedure to review instructions and drive you home. That person must stay in the waiting room the entire time of the procedure. If you're taking a blood thinner such as aspirin, Plavix, Coumadin, Xarelto, or Eliquis, please let your surgeon know, as special precautions may need to be taken. Never stop these medicines without discussing this first with your primary care doctor. Please arrive early to your surgery, usually at least 1 hour prior to the scheduled procedure. We hope that your procedure goes as well as possible and that you have a speedy recovery. We appreciate your genuine feedback regarding your procedure, as we are always trying to improve the care that we provide our patients. Should you have any questions regarding your procedure or recovery, please contact your doctor. Thank you.